Hi there, Mayor Rusty Bailey here. Our local hospitals are working extremely hard to respond to the recent increase in COVID 19 cases. Their surge protocols have added intensive care unit beds so that members of the community can receive the help that they need. Have a listen.
And we're back with another segment of Riverside Monthly. I'm Steve Brazel, joined by Mayor Rusty Bailey. Mayor, how are you, sir?
Hey, I'm here and I'm ready for another serious conversation with some serious individuals.
Yeah, and this month where all the topics are revolving in some tangential way around the pandemic that we're all going through. And on this particular topic, we're going to talk about Riverside's hospital surge protocols. We have two guests with us. First up, the CEO for the Riverside Community Hospital, Jackie D'Souza Van Blaricum. Did I get it?
You got it.
Good. And then also, and by the way, welcome.
Thank you.
Yes.
Parkview Community Hospital Medical Center. We have the interim chief nursing officer. It's Julie Curtis. Julie, hi.
Welcome to you too,
Hi.
Julie.
Thank you for having me.
Thank you both, Jackie and Julie, for being on this episode and for for the work that you're doing out there on behalf of the residents of the city of Riverside. COVID-19 obviously has been the defining event of the year, 2020. What does that look like from the hospital perspective?
It's been a defining event for us too, Mayor, and it's remarkable to see the community come together, all the hospital folks come together, our nurses, our physicians, our ancillary staff to care for unlike anything we've ever seen before.
Right.
This pandemic is real. We're seeing an incredible amount of patients coming to our facility, and we are not only caring for our COVID patients, but also those patients who need us the most with their heart attacks and their traumas and their strokes. So it's changed how we're delivering healthcare, and we also have great partners and great hospital organizations in our community, such as Parkview, where we're all coming together as one to deliver the care that we need to.
Amen.
And you mentioned something interesting that people forget about. We're going through the pandemic, and that has its own, load and toll on the system. But normal life continues. We still have heart attacks. We still have strokes. We still have other hospital needs for patients. Either one of you or both of you, for that matter, how have the hospitals and medical centers that you're at responded to the COVID-19 challenge?
Well, I would say for Parkview, we try to be very proactive in our approach, and we obviously had the gift of time. We knew what was coming. I think everybody was paying attention to what was happening over in Wuhan and then, of course, in New York. And so we had that benefit, but I don't think anybody really understood it until it's really here. And it really is a surreal thing to realize, okay, we're really in the midst of a pandemic and we're going to use our surge plans. And will they work? I would say we've responded very proactively, but there is no rule book. We've tried to do the best we could based on the situation at hand, and we're learning every day. And that's what I tell the staff as well. It is a day by day and not a sprint. It's going to be our new normal for a while.
Right. That's right. And we've seen numbers indicating. Well, you've heard the term. Let's give 110% to this effort, right? And we've seen numbers indicating that hospitals are operating at above 100% of their ICU capacity. How does that happen?
These are and Julie, being a nurse, can probably speak to this best, but these are very sick patients with high comorbid conditions, and they are staying long time in our ICUs just based on their severe acuity.
Yeah, I would definitely agree. I think the ICU capacity, and that seems to be the question in the community, is
yes.
Are you really full? And I can definitely validate, and I know Jackie as well, that we are full and then some. They are staying a long period of time. The length of stay is definitely not typical. And then you really do have placement issues. Where do they go? We have to make sure that there's a safe plan for them.
Right.
But these are some very sick individuals. So for anybody to think that the ICUs are not, at 200% capacity, really is not clued into what's really happening on the ground.
So we've heard the term surge event. For those of us not in the know, how does a surge event happen? And for that matter, what type of planning do you have to do because you're turning regular hospital rooms into ICU rooms?
What we've done here at Riverside is opened up an incident command center. And so there is a group of us that meet every single day. And we look at the data, we look at our projections, and then we communicate from the incident command center out to the organization to ensure that we have the appropriate PPE, the amount of beds. Staffing has been a big challenge across the country, as a lot of travel nurses are in Florida and Texas caring for those big surges. And so every day is about planning and projecting and conserving. And so a lot of work goes in the planning to be able to care for the surge.
Is there more equipment, different or more personnel, or is it both?
For all of us, it's both. So we have the ability to move ventilators, as an example, from a sister hospital in Kansas City or in Iowa to us because we are in a surge situation. And so we use the leverage of our company to be able to move supplies and even nurses to come help us during the surge.
Julie, do you have anything to add to that?
Yeah.
Or?
I would say it's definitely both. And I would say surge planning, like Jackie said, meeting daily and meeting in terms of what is going to be your challenges for the day, because it sometimes varies on the day. But I would say for equipment, we also have the ability to pull in from other facilities. But I think overall, everybody is really struggling with having enough and then having it at the right time when you need it. Staffing is certainly probably our biggest challenge. When you need critical care nurses that need very different ratios, that can be very problematic. And those nurses are very specialized and very hard to come by. And you don't want to burn out your current nurses. And we're really at that point where you're trying to encourage people to go the distance without really an end in sight.
So the public, seems to want to know about the ICU beds and the operating level. If they are operating at or above 100%, does that mean that everyone in the ICU has COVID-19? I think you spoke to that a little bit earlier, but could you flesh that out a little bit more and tell us kind of what percentage of the ICUs are COVID related versus otherwise?
For us, it varies between anywhere from 30% to 40% of our ICU beds are being filled with COVID positive patients, and it can get as higher than that. As I mentioned before, life still goes on, and unfortunately, people will have strokes or be in traumatic accidents or need cancer life-saving surgery. And I think that's also an important message, is that we're here for those other emergencies, and so the rest of our ICU beds are filled with those critically ill surgical patients or medical patients.
And I would agree. I think we're probably seeing a lot more COVID. Riverside's got a lot of higher level services, so they're able to take the heart attacks and the strokes. And I would echo that not enough people are coming in. It worries me. We're probably about 60% capacity in terms of our patients are COVID in our ICU, and especially coming from a lot of skilled nursing facilities, and they're very sick and they stay a long time. And so I think that for the public to understand that this is very much a challenge for our hospitals, but I would say that we are doing everything we can to keep people safe, and we encourage them to not delay coming to the hospital if they've got an emergency.
60% in your case. And Jackie, what did you say yours was, 35?
It goes anywhere from 35 to 40%, just given the services that we have here of being a STEMI center, stroke center, and trauma center. The beds are full.
And those are patients that you would most likely have not seen had we not been in a pandemic. That's all add-on. So that brings us to the key question, and we've touched on this in a number of the segments this month. How important are face coverings in limiting the spread of limiting the spread and keeping hospitals, working optimally?
For me, it's like wearing a seatbelt. You don't get into a car and not put your seatbelt on. I think it's critical. We need to do it, and it's going to save lives.
I would agree that it's such a minor inconvenience when you can save lives and prevent hundreds of people. The public needs to understand that there's a delay period where you can go upwards of 7 days without any symptoms, and you don't know that you might have just spread it to over 100 or more people. So the masks are such a simple thing that, and I know you see, us wearing them now. It has become my new normal. I definitely like a seatbelt. You feel almost bare when it's not there, and I think once the public realizes how simple that is and what part they play in keeping people safe and keeping our patients, safe, I think we'll be better for it.
And just so that everybody knows, the two of you are at work. The mayor is at the City of Riverside TV studio. I'm in my home. So wear your masks. Masks are medicine. Mayor, did you have anything else to add?
Just Jackie and Julie, I just want to thank you so much again for, your response to the healthcare crisis of our time, of our lives. And for all of the work that the healthcare workers are doing underneath the roof of those hospitals. Just God bless you for your service to humanity and especially to the residents of Riverside.
Yeah, we'll pass that along to our teams. Thank you so much.
Yeah, and let me just say, CEO for the Riverside Community Hospital, Jackie D'Souza Van Blaricum, thank you so much for joining us today.
Thank you. It's a pleasure.
And then the interim chief nursing officer, Parkview Community Hospital Medical Center, Julie Curtis as well. Thank you to you for taking time out of your day to help keep us all informed.
Thank you so much for having me.
Thank you.
Yeah,
Mr.
blessings.
Mayor, it's always good to see you, sir.
You too. We'll be back again.
We've got a number of episodes of Riverside Monthly this month, 4 to be exact. They all revolve in some way around COVID-19 or how the city is dealing with businesses and the pandemic situation that we're in. Make sure that you check out each and every one. I'm Steve Brazel, and we will see you on the next show.
Mask up, Riverside.
Thank you.
Thank you.
God bless.
You.